one of the main goals of treatment, if you're working from the neurodiversity paradigm, is as a clinician, is what's your role in helping to change the environment? So that could mean if you're working with a client who's in a school system that is not very accommodating, to provide some advocacy or help the client get access to advocacy so that they're not alone in advocating for themselves to get their needs met in that environment. So that's one of the main treatment goals, really, is looking at the environment, all of it, school, work, family too. Are there elements of the family system that, not out of maliciousness, but that are ableist, that are, adopting ableist attitudes, maybe unknowingly, that are really contributing to the mental health of that autistic individual in the system. So your role as a clinician might be psychoeducation for the family to help them understand their child better. So changing the environment, psychoeducation, helping the client connect. If, again, self-determination still applies. So understanding that everybody, each autistic person, just like each client, has their own pace and their own process. So if they desire to connect with other people, to help them gain access to those resources out there, to help them gain people who are accepting, who are going to be socially accepting of who they are. That's another goal of treatment. And a really important goal of treatment is, a lot of times what co-occurs with autism. Autism is not a mental health disability. It is a neurodevelopmental disability and difference. But mental health co-occurrences tend to be anxiety, depression, social anxiety, OCD, sometimes bipolar disorder. And so as a clinician, really assessing for that, which kind of gets into differential diagnosis and all of that, but really assessing for what are the mental health issues, and looking at trauma, family of origin trauma, relational trauma, multi-generational trauma, and how that intersects with the neurodivergence. And so that is a goal of treatment as well. Reframing negative perceptions, again, looking at really kind of confronting or looking at where it is ableism exists. Is there internalized ableism that the person has developed? That where they, like that, what that could look like, because I know that's kind of a clinical term. It could look like, I don't want to be friends. I don't want to do anything with anybody else who has autism because I'm not like them. So that's one way that internalized ableism might show up, because there's been so much, so much around them that's happened that's been very rejecting, that they don't want to see themselves as someone else who might be autistic, because they don't want to be treated in that way. So that's called internalized ableism. They've internalized it. So looking at that and helping a client just take a look at that, if, when they're ready, is also a treatment goal.